Welcome back to AI Paper Podcasts. We've all seen the headlines buzzing around, right? These stories about large language models, LLMs, just acing medical exams.
Yeah, passing the US MLE and things like that.
Exactly. And you hear about people, maybe even friends, trying them out for a quick self-diagnosis online. It really feels like healthcare is on the verge of this massive shift thanks to AI.
The potential seems enormous. I mean, these models, when you test them directly with medical questions, they show this really remarkable depth of knowledge.
It's truly impressive on paper. But that capability, those high test scores, they lead us straight to the core question we're tackling in this deep dive.
Which is?
Does all that knowledge actually translate into effective help for you, the end user, when you interact with these models for medical advice in a real-world situation?
Right. Can they really be that safe, reliable, new front door to medical info that some people envision?
Exactly. And to explore that, we're diving into a fascinating new study, a randomized controlled trial. It tested some well-known LLMs, GPT-4o, Llama 3, Command R+.
And crucially, it wasn't just testing the models in isolation. It had actual people, members of the public, use these LLMs to assess different medical scenarios.
Okay, so here's the headline, the one-minute summary, if you like, the absolute key finding from this research. The LLMs themselves, when tested directly, highly capable, knew their stuff.
Yep, good scores on identifying conditions, suggesting actions, all that.
But when real people, actual participants, use these exact same models for the same medical scenarios, their performance was, well, no better than the control group.
And the control group was just using standard methods, mostly internet search, Google, basically.
Right. So the big surprise is that the problem wasn't the LLM's knowledge base, it was the interaction. Something broke down when the human started talking to the AI.
And that's why the standard benchmarks, those medical exam scores, even simulated user tests, they completely missed this. They didn't predict this real-world performance drop.
The study's conclusion is pretty stark then. Despite the hype, current LLMs, they're probably not ready for widespread public use for medical advice without a lot more rigorous human testing.
It's a really important finding, especially given how fast things are moving.
It really is. Okay, so let's unpack this. How can something so knowledgeable on tests fall flat in practice? First, let's just quickly reiterate the promise, because it is real.
Absolutely. We've seen the papers showing LLMs scoring passing medical boards, sometimes even better than doctors on specific knowledge tasks, summarizing notes, initial triage from text.
Raw information processing is powerful.
Definitely. But we've actually seen hints of this interaction problem before, even with experts. Remember those studies with AI assisting, say, radiologists? Giving them AI tools didn't always mean better diagnoses. Sometimes the doctors using the AI did no better, or occasionally even worse than the AI working alone.
Right. Even the experts sometimes struggled to, trust the AI, or integrated suggestions properly.
Exactly. It's not straightforward. So that makes the idea of giving these tools directly to patients, people without medical training, feel like a much bigger leap.
Yeah, on one hand, it seems simpler, maybe, technically. Just put up a web interface, right? No complex hospital system integration, a new front door.
But the safety implications, the oversight, liability, it's huge. Experts are really divided on this, access versus risk.
And this study really zooms in on that patient-facing scenario.
Precisely. So the researchers set up this randomized controlled trial, a pretty solid design. They got 12,298 participants from across the UK.
And they made sure the group was representative, right? Stratified, I think they called it.
Yeah, stratified for UK demographics, age, gender, location, to make the findings more generalizable.
Okay, and what did these participants have to do?
They were each given one of 10 different medical scenarios. These weren't just made up. They were developed and validated by doctors.
Real doctors defined the right answers.
Yes. For each scenario, there was a doctor-defined gold standard for the correct course of action, the disposition, and the key medical conditions someone should identify.
And this disposition, it was like a scale.
Exactly. A 5-point scale. Ranged from just manage it yourself at home, all the way up to call an ambulance right now.
Yeah.
And besides choosing that disposition, they also had to list the medical conditions they thought were relevant.
Okay, so how did the LLMs fit in?
Participants were randomly put into one of 4 groups. 3 groups got to use an LLM. One used GB's 4.0, one Llama 3, one Command R plus Scilad. They could chat with it freely about the scenario.
And the fourth group?
The control group. They were just told, use whatever you normally use to look up health information, and unsurprisingly, most just used internet search.
Got it. So LLM users versus standard search users. And then the researchers scored their answers against the doctor's gold standards.
Correct, scoring both the disposition choice and the identified conditions.
Now, before we get to the human results, you mentioned they tested the LLMs alone first, as a baseline.
Yeah, that's crucial. They fed the scenarios and questions directly to the models, no human interaction, just to see, does the knowledge exist in the model for these specific tasks?
And how did they do?
Pretty impressive, honestly. Just like the benchmarks suggest, they identified relevant conditions in like 90 to 99% of the scenarios.
Wow. Okay, and the disposition, the action plan.
Their accuracy there was between 48 and 64%, which is, way better than just guessing randomly.
So baseline established.
Yeah.
The models do contain the necessary knowledge for these scenarios. They pass that test.
Right.
Okay, now for the main event. How did the human participants perform when they were using these LLMs compared to the control group using search engines?
And this is where things get, surprising and a bit concerning. Let's start with identifying the relevant medical conditions.
Okay.
Participants using the LLMs were significantly less likely to identify even one relevant condition compared to the control group.
Wait, less likely. With the powerful AI.
Yes. Across the LLM groups, the best performance was only about 34.5% identifying a relevant condition. Compare that to 47.0% in the control group using internet search.
That's quite a difference. The search engine users did better?
Statistically, yeah. The control group had 1.76 times higher odds of identifying a relevant condition. They were also better at spotting the serious red flag conditions.
Wow. Okay, that really undermines the idea that just giving access to a knowledgeable AI automatically helps. What about choosing the right action, the disposition?
Here, the results were different, but maybe equally problematic. There was no statistically significant difference in accuracy between the LLM groups and the control group.
So the LLMs didn't help improve the decision-making either.
Nope. Both groups got the disposition right about 43% of the time overall, which, again, is better than random chance, but still pretty low.
43% accuracy on whether to call an ambulance or just stay home. This doesn't sound great.
No, it's not ideal. And importantly, both groups, LLM users, and control tended to underestimate how serious the situation was. They leaned towards less urgent actions than the doctors recommended.
Which could be dangerous, obviously, delaying necessary care.
Absolutely.
So let's recap that core finding again. The LLMs, tested alone, showed strong medical knowledge for these scenarios. But when humans used them, they performed worse than search engine users at identifying conditions, and no better at deciding what to do.
Yeah.
Their performance was consistently worse than the LLMs operating alone.
That's the crux of it. Strong AI performance in isolation just did not translate to strong performance with users.
So the big question is why? If the knowledge is in the model, why couldn't people use it effectively? Did the study look into that?
It did. They analyzed the conversation transcripts between the participants and the LLMs. They wanted to see where that information exchange went wrong.
And what did they find?
Clear breakdowns. Now, the LLMs did often suggest relevant conditions in their chat responses, somewhere between 65 and 73% of the time.
Which is still lower than when they were prompted directly, interestingly.
Right. But even when the LLM did suggest the right condition, users frequently didn't include it in their final answer. The signal just wasn't getting through or wasn't being trusted or recognized.
Okay, so what caused that breakdown?
They pinpointed 2 main types of interaction failures. The first one is maybe what you'd expect. Users often gave the LLM incomplete information.
Like not describing the symptoms properly.
Exactly. The paper gives this example of a gallstones scenario. The user described some pain, but totally left out where the pain was, how severe it was, how often it happened, all critical details for diagnosis.
Right. Garbage in, limited output. If the user doesn't know what details are medically important, the LLM can't guess.
Precisely. The model's knowledge is kind of useless if it doesn't get the right inputs. But the second type of failure is maybe even more worrying because it points to issues with the LLM's interaction style itself.
Oh, what was that?
The LLMs sometimes gave really inconsistent or frankly poor quality responses, and it depended hugely on tiny variations in how the user phrased their question.
Okay, that sounds bad. Can you give an example?
The study highlights a stark one with a subarachnoid hemorrhage scenario. That's a brain bleed, very serious, often presents with a sudden, severe headache.
Okay, life-threatening stuff.
Right. So 2 different users were talking to the same model, GPT-4o, about this scenario. Both described the bad headache, stiff neck, light sensitivity. But one user happened to use the word suddenly when describing the headache onset in their prompt. The other didn't.
Just that one-word difference.
Just that. And the model's advice was drastically different. The user who didn't say suddenly, GPT-4o told them something like, try resting and take some over-the-counter pain relief.
Whoa. For a potential brain hemorrhage, that's dangerous advice.
Extremely. But the other user, the one who included the word suddenly, they got the correct urgent advice. Seek immediate medical attention, go to the ER, or call emergency services.
Wow. That difference it's chilling. It shows a model is incredibly sensitive to the exact phrasing. A user who doesn't know the magic word might get dangerously bad advice.
Exactly. It reveals a real fragility in the interaction. The knowledge might be in there, but accessing it reliably seems to depend on the user almost accidentally hitting the right keywords.
So it's not just about users giving bad input, it's also about the models being inconsistent or hard to query effectively.
It seems to be both. And looking at the sheer volume of suggestions didn't help either. On average, the LLM suggested about 2.2 conditions per interaction.
Okay.
But the analysis showed only about a third of those suggestions, just 34%, were actually correct, according to the doctor's gold standard.
So they're throwing out possibilities, but most are wrong or irrelevant.
Seems like it. And users, faced with this mix, seemed overwhelmed or unable to judge. They ended up listing fewer conditions in their final answers, about 1.3 on average, and their accuracy wasn't much better, around 38.7% correct.
So users struggle to filter the signal from the noise in the LLM's output.
That appears to be a major part of the problem. The combination of potentially noisy LLM output and the user's lack of medical expertise to evaluate it led to poor overall performance.
This really hammers home that the bottleneck isn't just the AI's knowledge, it's this whole interaction layer, which explains why the standard benchmarks didn't see this coming.
Right. The study explicitly tested that connection too. They looked at things like MedQA, a standard medical knowledge benchmark.
And the LLMs crushed those, right?
Yeah. On relevant questions from MedQA, the models often scored over 80%, sometimes over 90%. But remember, the human participants using these same models were correctly identifying conditions or dispositions at rates sometimes below 20%.
So success on those isolated Q&A tests just doesn't predict real-world interactive performance at all.
Not even close, it seems. MedQA measures stored knowledge retrieval in a very structured way. It tells you nothing about how well a user can elicit that knowledge through conversation or interpret the output in a complex scenario. It's a totally different skill.
A crucial difference many benchmarks miss. What about simulated users? Isn't that supposed to test interaction?
They looked at that too. They tried using another LLM to simulate how a human might interact with the medical LLMs. It's an approach people are exploring for scalable testing.
Did the simulation match what the real humans did?
Not really, no. The simulated users actually performed better than the real humans.
Better? How?
They were more consistent, less variable in how they asked questions compared to the real people, who were much more diverse and, frankly, sometimes unpredictable in their interactions. The simulation results only weakly correlated with the actual human results.
So even our attempts to simulate human interaction for testing aren't capturing the real complexities or these critical failure modes.
It appears not. Relying only on simulations before deploying these things widely could give a completely false sense of security.
Okay, so pulling this all together, what are the big takeaways here, especially for, the researchers and engineers listening, people building these kinds of AI systems?
Well, the main conclusion is pretty unavoidable, I think. These current general-purpose LLMs, despite the impressive benchmarks, they just aren't ready for prime time as direct-to-public medical advisors.
Passing an exam isn't the same as helping a person safely navigate a real health concern.
Exactly. The context of human interaction, especially with non-experts, changes everything. So for AI development, this study is a huge signal. The focus has to shift.
Beyond just making the models smarter in isolation.
Yes. We desperately need research focused on improving the interaction capabilities. How can LLMs communicate more clearly to lay users? Give better explanations, maybe more structured output, perhaps more reliable single recommendations instead of a confusing list of possibilities.
On the flip side, making the models better at handling messy human input.
Absolutely crucial. We need models that are more robust when users give incomplete or slightly wrong information. Models that can maybe recognize they need more data and proactively ask clarifying questions, guiding the user.
Instead of just passively responding to potentially flawed prompts, like in that Hemorrhage example.
Right. The current models seem too reliant on the user having almost expert-level prompting skills to get the best, safest information out of them reliably.
What about for doctors and nurses on the front lines?
They need to be aware that patients might show up having used an LLM, and the conclusions they've drawn could be, well, pretty inaccurate, maybe no better, or even worse than what they'd get from a quick Google search.
Good point. And for the policymakers, the regulators.
The paper has a very clear message for them. Prioritize systematic testing with real human users before these systems are deployed publicly in high-stakes areas like healthcare. Technical benchmarks and simulations alone are not enough. They don't predict real-world safety or effectiveness.
We need to evaluate the whole system, human plus AI, in realistic settings.
It's the only way to be reasonably sure.
So wrapping up this deep dive then, the potential for LLMs in healthcare, and honestly many other fields, it's still huge, transformative even.
No doubt about that.
But this research shines a really bright light on a critical bottleneck right now. It's not just about the AI's raw intelligence. It's about that incredibly complex and apparently quite fragile dance between the human user and the model.
That interaction layer, how information gets communicated, understood, misunderstood, acted upon, that's where the system is showing major weaknesses, at least for non-expert users doing critical tasks.
And that leaves us, and you listening, with a pretty provocative thought to chew on. If even these highly capable LLMs, packed with knowledge verified by tough benchmarks, struggle this much to effectively help people with something as vital as medical scenarios, what does that tell us about the hidden challenges of deploying AI in any complex field where human understanding, interpretation, and interaction are key? Are there other areas, finance, education, legal advice, facing similar hidden interaction failures that our current tech benchmarks just aren't designed to catch?
It's a critical question. How do we move beyond just building intelligent machines to building systems that are truly usable, reliable, and safe when they partner with diverse, imperfect humans out there in the real world?
Something important to think about. Thanks for joining us on this AI People Podcast Deep Dive.